Done. Also joining me today, and I'm super excited about this, are 3 of our current nurse residents who are in the Stanford Health Care Nurse Residency Program. These 3 individuals make up, they are 3 of the 46 individuals in cohort 32, which started this summer. So Vanessa Urbina is here. She's a clinical nurse 2 on K7, which is trauma surgery. Nijj Kaur is a clinical nurse 2 on J5, which is cardiac surgery, LVAD and heart transplant. And Kate Formaker is a clinical nurse 2 on E2, which is one of our medical oncology critical care units. So the 3 of them are here today. I have asked them all to provide you with a little bit of insight on what their experience was like participating in virtual interviews. They all went through the virtual interview process, what worked for them, what was challenging, tips and tricks, what made them successful. And then at the end, if you have any questions for them, please, they're here. They are a great resource. Anything from their onboarding, orientation, how do they prepare themselves? What has the transition been like to independent practice? They're all functioning independently on their units. They have a group of new grads who are behind them. So they are moving on the path and will graduate this summer. So they're here today. I'm very excited to have them with us. So questions for them, keep them coming. Okay, we are going to jump right into it. We always have objectives in everything we do. So the goal of today is really to give you an understanding of the interview process and structure, as well as talk a little bit about behavioral style interviewing, because that is the structure that Stanford uses when we interview not just our nurse residents, but all of our prospective candidates. I will also, I've thrown up a slide there on what are our application requirements. We get this question a lot. So feel free to snap a pic of it. Again, this webinar is recorded, so you can look at that, but it's just gives you a little bit of insight for those of you who are potentially not at the interview stage and maybe looking to apply. That information will serve you well. We also get a lot of questions on cohort timelines. When's our next cohort? I have those dates for you. Any questions about clinical placement, I'm happy to answer. And then just a little bit about our nurse residency program. Not a whole lot, but just give you a little bit of insight of what that program looks like. So for those of you who are participating in our panel interviews, they will start next week and continue the week after. And then even if you're not, this information will carry over into future cohorts. So the only thing that may change is the way that we conduct them, whether it's virtual or in person. So before COVID, everything was in person. We've shifted to a virtual platform. We use Zoom for all of our interviewing. And hopefully when we can kind of move through COVID and be able to come together in person again, we will return to our live interview environment. Currently, we accept nurse residents into 4 areas: critical care, oncology, medicine, and surgery. And of those 4 specialties, all of them have their own interview panels. So on the application, for those of you who have applied, you rated by preference your top 4 choices and rank them. This is my first choice, my second choice, my third choice, my fourth choice. Kev and I work really hard to place you in your top 2 choices. So if you put critical care as your first choice, and that's really where you want to work, and we've reviewed your application, we feel like you are a qualified candidate, then you will interview during the critical care panel interview in front of the critical care hiring managers. Same goes for oncology and medicine and surgery. Critical care, oncology, and medicine have a 2-day panel, 5 panels per day, 20 candidates per day with a total of 40 candidates interviewing for each of those panels. Our surgical units, the volume is more, and so we actually have 4 days of panels. We have split our hiring managers into 2 groups. So we have a Division 1 and a Division 2. And so Division 1 interviews candidates over 2 days. Again, 40 candidates, 5 panels per day. And then Division 2 does the same thing. So 80 candidates interviewing in the surgical region. And then the number of positions being hired, again, tentative. Sometimes we go over if there's really great candidates and managers want to hire more. But essentially, we're looking at around 55 candidates for our spring cohort. On the panel will be all the hiring managers for the specialty in which you are interviewing for. And then there will also be a facilitator on the panel. And the facilitator is really responsible for kind of running the whole show. So they welcome the candidates, they explain the process and the structure, they ask all the questions, and then they close the interview and provide next steps. Our reason for doing that is that we give you the same consistent information every panel, and so we just have one person who manages all that information. All of our questions are behavioral style interview questions. You will be asked to introduce yourself, and then you will be asked to answer only 4 behavioral style interview questions. So if you are sitting on any of the panels over the next 2 weeks and you've introduced yourself and you've answered 4 questions, you will know that you are done and the interview is over. So really only 4 questions. And the way that we do those 4 questions is there's a domain. We tell you what the domain is. So for example, one of our domains is compassion and caring. Gives you a little insight of kind of what we're looking for. And then we ask you the question. We ask the same 4 questions to all of the candidates, but the way we do it is in a rotational order. So you will hear the same questions over and over again, but the way that they're asked will be in a rotational order. Our structure, we give each candidate the opportunity to introduce themselves. We ask you to tell us your name, your degree, where you received your nursing degree, where you had your capstone senior preceptorship. And I know for many of you, you may have not had a senior preceptorship, or it potentially was modified or it was virtual. That's okay. Please tell us that. Work experience. Any work experience does not have to be healthcare related. So if you worked at a restaurant for the last 5 years, please tell us. Shine, tell us what you did. We want to know that. And then you'll get a question potentially about why Stanford, why did you choose nursing, why did you choose critical care nursing? So trying to get to know you a little bit and kind of why you chose this career path. Then we'll dive right into the behavioral style interview questions, and then the facilitator will conclude the interview. The conclusion will sound something like this. Thank you for joining us today for the nurse residency panel interview for the critical care region. The critical care region started their panel interviews yesterday and will conclude today at 4 p.m. At that time, all the hiring managers will come together and discuss all of the candidates. Should a hiring manager feel you would be a good fit for their unit, they will reach out to you by phone and offer you a unit level interview. Unit level interviews will take place starting, and they will give you a date, and then they will let you know the end date of when those unit level interviews will last. Then the facilitator will say, if you do not receive a phone call from one of the managers, human resources will be reaching out to you within the next 10 business days to let you know the status of your application. We do not give you the opportunity to ask questions during this panel interview. And the reason for that is because all of the managers are hiring into different shifts. Their specialties are different. We have 2 different precepting models. So some of those units are doing one of our pilot precepting models. Others are doing our standard precepting process. So we don't want to confuse the information. So we ask that you save all of those burning questions, which I know you guys have, until the unit level interview. And that is the opportunity for you to ask about shift, team dynamics, educational opportunities, the unit specialty, any of those questions that you have about the position, the specialty, and or the unit. So you will bring those questions to the unit level interview. We get a lot of questions about what is the unit level interview like. So again, all of our interviews are highly recommended to be virtual. So it could be phone, it could be a WebEx, it could be a Zoom. Who would be on that? So that's really up to the discretion of the manager. Some managers do one-on-one. Some managers invite their leadership team, their clinical nurse specialist, their nurse educator, and then potentially some staff. Some ask some of their nurse residents to sit on that interview. So it really depends on the manager's preference. I will tell you, we see a combination of behavioral style interview questions, clinical questions. How would you manage this patient? How would you prioritize these clinical tasks? And then questions that are a little bit more probing about you. What are you passionate about? What are your goals? Where do you see yourself in 2 years versus 5 years? Again, the manager and the management team are trying to get to know you a little bit more intimately as a person. And so you might get some of those questions about what are some of your goals and passions and things that you enjoy outside of the work. So they're trying to connect with you a little bit. So for those of you who have applied for this cycle and looked at the application questions, you notice that the application questions were a lot about who you are as an individual. So questions about what your goals were and what obstacles did you have to overcome, or a time that you made an error in judgment, or a time that you provided service to the community. So the application really tries to get to know who you are as a person, and we read those questions really intently. That's the most weight of your application points is those questions. And we look to say, does this person represent what we're looking for in a Stanford nurse? Do they have the resiliency and the compassion and the dedication to the community and the team? Have they demonstrated that? And if we say yes, they have, then we're going to bring you to the panel interview. And the panel interview is the time where you can say, this is how I've demonstrated all those qualities as well as my clinical competency during my clinical rotations. So that application is really who you are, and the panel interview is how do you perform? And then we kind of collaborate those together, combine those together, and that's how we choose our nurse residents. With that said, when you come to the panel interview, we know that your work as a student nurse is limited by scope. So remember, when you're applying, you are at that advanced beginner stage. So we follow Benner's novice to expert. I know a lot of you have probably seen this. You're not a novice. Novice is no experience. You've had that experience. So you come to us at that advanced beginner. So your answers are gonna highlight that advanced beginner level. So don't feel that because I don't have this amazing story of where I saved a person's life by myself, et cetera, that I'm not gonna get a job. That's not what the manager is looking for. They know that the situations are going to meet you where you are in your skill and competency level. So it could be something as, I was dealing with a patient who didn't want to get up and walk. And so the goal of the day was to get the patient to walk. So these are the resources I used. This was the creativity. I realized I had to meet the patient where they were. I set up a time. I made a commitment. I asked him what he needed. I made him feel safe. These are all the things I did. And then I got him to walk. If that is your story, shine and tell us. So again, looking at that advanced beginner level for your answers during the panel interview is perfectly correct. So let's talk a little bit about behavioral interviewing. That is the style that we use. It focuses on your past experiences. So not what you would do, but rather what you did do. And we're looking at examples of how you've demonstrated certain behaviors, knowledge, skill, and ability. And why do we do this? We do it for two reasons. One, knowing how you demonstrated something in the past serves as the best predictor of how you will respond to a similar situation in the future. The other reason we do it is because it allows us to have objectivity when we evaluate a candidate. We give you all the same questions. There's a predetermined rating scale, and all the questions are related to the job that you are applying for. So it really allows the evaluator to be objective when they score candidates. Know that the questions tend to be pointed, probing, and specific. They also tend to have multiple questions within them. So it will say, for example, tell me about a time during your clinical rotation where you had a challenging patient interaction. What was the situation? What action did you take to manage the situation? And what was the outcome? So you know, I got to tell them what happened. I got to tell them what I did. And I have to tell them what the end result was. That's the three things that they're looking for. Often the questions are phrased, tell me about a time, or provide me with an example from your clinical rotation. You'll hear the word clinical rotation. If you hear the word clinical rotation, answer it from one of your clinical rotations. The key to interviewing for the nurse residency program is we want to hear about examples and experiences and behaviors that you've demonstrated in the role of a clinical nurse. So a lot of you have a lot of different experiences. You may have previous jobs. You may have been a nursing assistant or a pharmacy tech. A lot of different experiences, which are great. And that adds to who you are as a person. But in terms of the question, if the question is asking, tell me about a time during your clinical rotation, because you are applying for a job as a registered nurse, tell us about a time when you've demonstrated in that role. Rather than, let me tell you about a time when I demonstrated as a nursing assistant. No, we want to hear how you demonstrated that when you were working in the role as a nurse. So how do you prepare? It's the question I always get before. You need to start thinking about your clinical rotations and stories about times when you've successfully solved a problem, when you performed memorably, when you've provided compassionate care, all of those aspects of nursing. And then you want to write down what were the details of those situations. Where was it? What hospital was I at? What unit was I at? Was it my med-surg rotation? What was the issue? Was it conflicting priorities? Was it delegation? Was it compassionate care? Was it an end-of-life situation? What was either the challenge, the concern, or the event? And then what did you do in response to that challenge, concern, and event? Did you manage a situation by prioritizing? Did you have to escalate? Did you have to communicate? Did you have to bring in additional resources to support you? What did you do in order to manage that situation? And then what was the outcome? So what was the outcome for potentially the patient, or maybe it was for the team, or maybe it was from you and you learned something from that event. So really you want to start thinking about your rotations and scenarios from those rotations and be able to tell the story. Be open and honest. These are your stories. Be proud of them, share them, and don't leave out the small details that you may think are not important. They're important. The little things that you do to help a patient, the compassion that you provide, the caring environment that you have created, that's important. So tell that story. Tell the full story. So again, 3 parts: situation, action, and outcome. Often, candidates don't tell the outcome. Tell the outcome. Your situation is great. We're so interested. Oh my gosh, your actions were great. And then you either say, I don't know the outcome. I don't know what happened. And you leave us. Or you don't even answer that part. We see that often. I hate when candidates have this great story and they lose points because they didn't answer all 3 parts of the story. So make sure when you're telling a story, there's some sort of outcome. Maybe the patient was transferred to the ICU and that was the outcome of that patient. That's the outcome, but maybe you want to share a little bit about what you learned from that experience or how the team dynamic changed based on that. That's also an outcome. Practice, practice, practice. There's a couple reasons why you want to practice. Interviews are stressful. We see you guys being nervous. I've been in interviews. We know it's nerve-wracking. What I always say to my nurse residents, the more you expose yourself to things that make you nervous, the less nervous you will be. So sit in front of a mirror or with a colleague or a family member and talk. Talk through how you would answer certain questions. The more you expose yourself, when you sit down at that panel interview, there's going to be a layer of anxiety that's removed because you've exposed yourself to a situation that's similar. The other reason you want to practice is because you allow yourself to catch yourself when you start trailing off. We don't time you, we don't time your answers, but you want to try to have your answers flow so the audience understands what you're saying. So when you talk things through, you have a beginning, middle, and end. And sometimes when you practice, you go, oh man, I'm all over the place. Let me restart. So give yourself that ability to practice so then when you go into the interview, you don't find yourself in that situation. So how do we choose our behavioral interview questions? We have a pool of behavioral interview questions that fall under 4 domains. In the morning of the interview, we say to the hiring nurse managers, please select one question from the 4 domains, and you will use those questions for all the individuals who are interviewing in that specialty. So think of all of the layers of nursing, all the things you did in your clinical rotation. You communicated feedback, you escalated, you communicated effectively, you had challenging communication, you had great communication. Time management. Did you cluster care? Did you use a brain sheet? Delegation. Who'd you delegate to? What'd you delegate? Did they do it? Was it successful? Was it not successful? Conflict resolution. Was it team conflict? Was it between you and your preceptor? Was it patient-family conflict? Compassion and caring. Oh, always a compassionate and caring question. Always, always. How did you provide that care? What did you do? How did you advocate? How did you prioritize? What did you do first, second, and third? And why? Did you have to delegate? Did you need help? Education. How did you provide education to a family, a patient, yourself? What did you learn? So these are all aspects, and there's more. So that's what you want to think about. What are all the things I did in my clinical rotation in terms of my job role? Those are questions that you're going to see, both at the panel and at the unit level. So how do I answer these questions? The first thing I say, listen to the question. If you don't understand the question or your mind went blank because you were really nervous, then you say, I'm sorry, do you mind repeating that question? Not a problem, of course. The other reason why you want to listen to the question is because you will hear another candidate answer the same question. What we have seen is the first person who gets the question, if they answer it incorrectly, everyone else answers it incorrectly as well. So listen to the question for your true self. And if Mary, the candidate to your right on Zoom, answered it and you're like, I don't think she answered the question. She probably didn't. You listen to the question and you answer it as how you feel best. Don't let other people's answers influence you. I recommend you think of the STAR method. You don't need to call it out, but know that the questions are going to go situation, action, result, outcome. So consider that as you're letting your answers flow, beginning, middle, end. Know your audience. So if you are interviewing for oncology, oncology adult, so again, we are doing all adult. We love to hear about all your different clinical rotations, but if you only tell us about psychiatric clinical rotation for all 4 of your questions, it's really hard to see how you would perform in an inpatient, non-psychiatric adult area. So my recommendation is to know your audience. So if it's adult, some of your answers should reflect the adult population. If you're in the medicine panel and you've had med-surg clinicals, which I know you all have, that would be helpful to bring some of those up. If you're interviewing in ICU and you've had ICU or ED preceptorship's great. If you haven't, that's okay. But again, we've seen people talk all about their pediatric rotation, and the manager will simply say, I really liked that individual. My concern is, can they transition into the adult world? They seem very pediatric focused, and maybe that's their passion. So you don't want to confuse your audience. So know the role. One, I'm interviewing for a registered nurse role, so I want to talk about my preceptorship and my experiences as a student nurse when I demonstrated that role. And I want to know the audience that I'm interviewing for, the panel, the specialty, the patient population. Again, use those examples from your clinical rotation, and then try, and it's really hard on Zoom, and we know this, but allow your answers to be a vehicle to showcase your personality. So remember, one of the hallmark things about being a nurse is that instant human-to-human connection. And I know our nurse residents can speak of this, but it's the ability to walk into a room and immediately connect with a patient and family member. It doesn't take a lot. And so we try to see your personality, who you are, during the interview on Zoom. So try to relax, engage with your audience, smile, anything that shows your personality. If you're really nervous and that's going to be really hard, then you got to let your answers showcase that personality for us, because a lot of nursing is that ability to connect with people. These are some examples of behavioral style interview questions. Again, you can take a little screenshot, but they're all about situation, action, and outcome. So you'll see that over and over again. The last one, tell us about a time you received constructive feedback from a member of the healthcare team. What was the feedback? How did you respond to the feedback? And how has that feedback shaped your current nursing practice? So again, situation, what did you do? And what was the outcome? What did you learn? So you'll see that continue that same sequence with all of these questions. Okay, so basic tips. We talked about knowing your audience. You're going to provide examples related to the position you're applying for. Please do not read your answers. So this is something we're seeing with virtual interviewing, and I get it probably decreases some anxiety, and we see that people often their eyes are above the computer and they're reading something. And it's so succinct and so clear and so perfect that you can tell that they're reading. It's not natural. In that moment, you've lost the human to human connection. So do not read. Come, practice, allow yourself to shine. We have had candidates who go, oh, sorry, let me backtrack. And they've stumbled through and they've recovered and they've been offered positions. So it's not on perfection. It's not on, I'm just going to sit here and smile and everything is going to be perfect. It's who you are as a person. Tell us your story. We're trying to get to know you. And then we're going to bring you in for that unit level interview, try to get to know you a little bit more. So be gentle to yourself and just come with your true self. So do not read. Do not read. Again, listen to the question. If you need clarity, ask. Answer all the questions. Breathe. Connect with the panel, human-to-human connection, and then practice. And practice out loud is one of the things I would recommend. So with all of these tips, the next thing I'm going to do is I'm going to ask our nurse residents who are on the call to turn their mics on. And Vanessa, maybe we'll start with you. If you can share with the individuals on the call what you did to prepare, what you felt like the panel interview was like, and any tips or suggestions or recommendations you have for them.
All right. Hi, everyone. Not gonna lie, I am even nervous doing this, especially with like over 200 people. But my name is Vanessa. Little background, I graduated from San Jose State. And so essentially before, I don't even know where to start. So pretty much before I got the interview for Stanford, I had already been practicing all my interview questions and everything because I graduated in December 2019. And so I got an interview for Stanford for the summer cohort. And so I had already had some interview practice before the Stanford interview. So luckily that was able to help myself like know where my weaknesses were. But even then, once I graduated, I like Googled everything. I Googled all behavioral questions, like every possibility. I would write down all of my stories because it's hard, to like backtrack and really think about what have you experienced. Because like when you're in clinical, you think like, oh, I didn't do much. But then when you look back at it, like there could be one little thing that really made a difference in a patient's care that you weren't aware of, but it did. And so for me, like once I noticed that the main way to like set up your answers was the STAR method, I would type out like STAR for each like behavioral question that I found, and I would find like one or two examples I could use and write it out that way. So for S, I would specifically have like a one-line thing for the S part. I really tried to focus more so on my like action and the result because again, I like YouTube Googled everything and that's what they pretty much said to like focus on because that really shows like who you are. It shows the type of nurse you are willing to be and what you are willing to learn from your mistakes. And so I typed it all out. I would like say it out loud to myself, but the thing too is that you, like Kerry had mentioned, you don't want to like just read off of something because one, it is obvious, especially with it being virtual, but also you want it to be more like a conversation style with somebody. And so pretty much I would read out loud to myself and everything, but then me and my friends, like we would message each other and we would be like, hey, does this sound right? Like just getting that feedback from your peers really helps. And I know some of you may be like, oh, we're all interviewing for the same thing though, it's like a competition. But in reality though, like you won't get anywhere in life really if you don't have that support from one another. So you really need to like lean on each other to sort of like embrace that confidence of each other, if that makes sense. I don't really know if that makes sense, but and so like me and my friends, some of us would like FaceTime each other. And so it does feel weird, honestly, like telling someone your story. But it really makes a difference in how you speak and also in how you prepare for your future interviews. And so that way, like, honestly, could even be like rewording questions or like them telling you, like, oh, I think you should emphasize on this instead of this. That can make a difference in how you respond. And so not only did I have it like online, but honestly, I would write it out too, because the more I wrote it out, the more it stuck in my head. Because even though it's something you experience, of course, during the interview process, you can, all the like nerves and jitters comes to you. So it's easy to forget. So that way, the more you practice, it's more like ingrained, or is that the word? It's like stuck in you, right? But honestly, I would say though that during the interview, I had a piece of paper right next to me. And so once I heard a question asked, I would write that question down. I would make like 2 or 3 like notes about which story I would use for that question. And so then that way I would be done with that. And then I could focus more so on who was speaking and actually try to interact in that way. Because, you know, online it's difficult to show you're paying attention and all that stuff. You can get easily sidetracked. But honestly, you hear other people's responses and you're like, damn, like you went through that, you know? And so like it's good, like use your facial expressions, you know, that you're paying attention, that it also makes you feel more relaxed too. Because then it's like you're not just focused on, okay, what am I gonna say? What am I gonna say? So I would do that. And honestly, too, like even during the interview, it's okay to take a pause before you speak. Like you want that break before you speak because it's your way of gathering your thoughts. And then when you're ready, like start your story. Of course, don't take like a full minute before you speak, but just like, you know, looking over your little notes that you wrote, and then, okay, like take that breath and then go for it. Um, but yeah, I don't know what else to say. I don't know if
No, I think that's great, Vanessa. There will be questions at the end, which I'm sure they will have for you, but thank you for your insight. Nijj, do you mind sharing what your experience was like?
Of course. Hey, everyone. I actually also graduated with Vanessa in December 2019. And like Vanessa, I had a lot of experience. Well, not experience. I had interviewed at 1 or 2 places while I was waiting to study for my NCLEX. So I had already gotten an idea of what I need to work on. One of those things was learning how to be concise in answering my questions. Usually when I would hear a question, I noticed in my head, I would like freak out a little, even though I practiced these questions at home and I had answers for them. So after 2 of them, I was like, okay, what do I need to work on? Sometimes I would ramble. And what really helped me out was getting, I think I had 5 stories where I wrote them out in a way where I knew it could answer any type of question that I can receive. And how can I use the same story to highlight how great of a nurse I can be at Stanford, or what qualities I can bring to Stanford. And once I was able to do that, I noticed I was a lot calmer. I would take time speaking. I wouldn't speed through my answers really. And it really helped me feel more confident when I was doing the interview process. However, Stanford was my first Zoom interviews. The other ones I had were really early on, so they were in person. So it was a little awkward. But the great thing about Zoom is you don't have to make eye contact. Like you just look into your camera and it looks like you're speaking to the manager itself. So really use that to your advantage. Some things I had also done is I had gone online and like Vanessa did a lot of research. I went on YouTube as well. There's a lot of RNs who give you great tips on how to answer certain questions that you may not know how to respond to. The main ones are, what's a mistake you made? Obviously, you don't want to talk about like a huge med error, but like how did you overcome that issue and how did you respond? And that's one of the main things, because mistakes will happen while you're at work. You may have forgotten to communicate something, or some issues may have come up. They want to see how do you respond to an event that you weren't expecting practically. Some other things we had done, or the way our questions were set out, were very, I liked how concise it was, where everyone almost got the same questions, and they had a group where it's like behavioral or quality metrics or evidence-based or whatever it may be. I also utilized a lot of the nursing students I had met throughout my years from my school. Is I messaged them on Facebook. I'm like, oh, hey, I'm interviewing for these new grad programs. What advice would you give? And I messaged a bunch of people, and they were all very kind, where they gave me a lot of advice. Not only that, they also sent me their questions as well, which was, I feel like, one of the main things that helped me out. Most of them, although they were not working at Stanford, they had a pretty good document where I feel like those questions are current questions that the hospitals were asking. On Google, like, you may find the generic version of behavioral questions, but I feel like it was really helpful for me to have my peers send me questions that they got a couple months ago that may be pertinent now, that may not have been important in the past. So yeah, a weird thing that I had done to prepare after I realized, like, oh, I ramble and I'm not focused when I answer my questions, I took a video of myself, and that was the most awkward and embarrassing thing I had to do. But because I took a video of me answering these questions, I was able to then criticize myself and see, okay, what did I not like about that? And then because I was able to take notes on myself, I was able to then see myself from, let's say, the other person's point of view, on how I answer my questions, how I approach things, and was really able to fine tune my answering process. Another tip that I had taken is I had decided to become very logical in my answers. Initially, I would give like a whole background story when that wasn't necessary. If they had a question, for example, when did you have a difficult patient? What did you do and what was the outcome? Then, like Kerry said, I would literally answer just those three things. And I noticed that also certain interviews have like limitations, like your answer should be 2 minutes long, or your answer should be only from this experience, and all of that stuff. I would really read that email, make sure my answers or the way I answer them touch those bullet points and I did not miss anything, because those minutes are the only time you can display or illustrate who you are as a person, and then how did you deal with all those situations. When I did become logical with my answers, I noticed it also helped me be more calm and concise and get my point through without having to take a big chunk of time practically. Another thing I did is, that I think is very important, that I forgot to mention, is they always ask you to introduce yourself. Make sure you say your full name, what your school is, and then I think what I tried to do is, I think our question was, why do you want to work at Stanford, along those lines. And I remember I put my passion for nursing into why I wanted to work for Stanford. Another great tip is read all of Stanford's missions, what their goals are. If you're interviewing for the surgical AAUs or ICUs, they also have their own submissions and goals. So I had actually, like the day before, I had gone into the surgical AAUs and saw what are their goals, what are they trying to achieve, what are some things they're working on. And then in that beginning question, I was like, oh, I want to work at Stanford for this and this point, and my values and goals align with Stanford's goals, and along those lines, if that makes sense. This way, you're able to tell them what your goals are, what your passions are, but at the same time, show them that you have the same passions and goals as the facility or hospital that you're trying to work at. I feel like the internet is your best friend, and read as much as you can, take your notes, and take it easy in a sense. It is serious, but at the same time, you can be as relaxed as possible, because the goal is just to pass a set of ideas. You want to make sure that they understand your outlook on nursing or how you want to work, and they're able to get that through the interview that they're having for you. I think that's about it as well.
Thank you, Nijj. Awesome tips. Kate, if you would mind sharing your experience.
I'm Kate. I graduated same as those two in December of 2019. Yeah, I have the unfortunate task of going third. They all gave great advice. I do want to reiterate just some of the points of kind of like, it seems obvious that we all somewhat over-prepared, which made us more comfortable. And I think by being in this webinar, you guys are already on that path of trying to get as much advice as possible. And I think it's important to recognize all the work you put into this, because clearly you're going to, and that is going to prepare you. So take a breath and know that you've done the work to get here already. But yeah, same thing. I reached out to the connections I had to get tips and tricks from people who had interviewed previously. I Googled behavioral questions. I looked through my clinical journals that they made us do in nursing school that I thought were silly, but ended up being beneficial to remember certain circumstances or things like that. I know for me, at least, like I definitely walked into this feeling like, oh, I don't have the insane clinical experiences that I should have gotten. Like I don't have those crazy stories, but I tried to focus on what was going to make me stand out. And I thought that, or I felt like a lot of my answers fell more into that caring and compassion category. And it seemed like, for me, it felt like I was missing certain aspects because that's what most of them were. But it really is, when you look through all the behavioral questions, it felt like I was able to use those examples more. So it's like, what I'm trying to say is you're not going to have the experiences of a nurse who's been at bedside for 5 years. So know what you've got and know that you have the appropriate experience they're looking for. But ultimately, yeah, again, third person, trying to reiterate the same things they're doing. I think for me, in the interview process, I didn't have any of my answers in front of me because I'd reviewed them time and time again already. I did what Vanessa did, where I took notes on what the question was, what the parts were that I specifically needed to answer. And then I just tried to engage with the people in an interview, much like I would in person. And it made it feel somewhat more normal because Zoom does not feel normal. And it allowed me to kind of just let my own personality shine. I know that everyone in these interviews are amazing candidates who are going to be amazing nurses. And I felt that part of what was going to set me apart is my personality and hopefully them getting to know me. So that was kind of my goal, I guess, in the interview. Yeah, I don't want to beat a dead horse and repeat the same thing. So that's kind of my like extra tidbit for you guys. Yeah.
Great, thank you, Kate. And we will circle back with these ladies at the end. So if you have questions specific to them or just to all of them, put them in the chat and Kevin will ask them as we go forward. So very quickly, currently these are our requirements. If you are looking to apply, you can take a snapshot. We'll post this. This is also on the application. But again, a graduate of a BSN or MSN program that's accredited, no more than 18 months from graduation to cohort start date, no more than 6 months experienced as a registered nurse. And what that looks like if you do part-time RN experience, it's 6 months of hours. So it can go beyond 6 months time frame part-time, but no more than 6 months hours full-time work. And then the requirements of a cover letter, a resume, letters of reference from nursing clinical faculty, not a preceptor, transcripts, and then the completion of the electronic application. And my recommendation is when you look at what are the requirements, if there are specific things, for example, for volunteer experience, we ask for specific information regarding your volunteer experience, including your hours, your role, what you did, and the contact person or agency and their contact information in order to give you credit for those hours. So if you see things like that where there's specific that says please provide that so we can get a little bit more information and then give you credit going forward. We have 3 cohorts every year, a fall, a spring, and a summer. We are interviewing next week for our spring cohort that will start February 22nd. We currently hire into all of our ICUs, all of oncology, all of surgery, all of medicine, as well as our float pool, and then our observation unit, which for all intents and purposes functions as just an inpatient medical unit. They receive ED overflow and some post-procedure patients, but essentially observation patients stay for a short period of time. And so billing wise, they are billed as observation rather than inpatient. So still inpatient unit functions as an inpatient unit, but we give it the term observation. Our summer program will hire into the emergency room observation area for the first time. We are partnering with the emergency department to bring nurse residents into their observation area to start, and then transition them between 6 months and 1 year to the adult emergency room. So exciting. That is the June cohort. We'll do more marketing about that after February, but that is to come. These dates are all on our website online, but just a little information about when applications open, panels, and then the start date for the cohorts. The reason I put the panel interview up is because you need to have your RN license before you sit for a panel interview. So for some of you, Kevin called to say, we're excited to offer you a panel interview, and the first thing he asks is, do you have your RN license? And if you say, no, Kevin, but I'm taking it on January 11th, I'll say, great. I'm going to call you on January 11th and see if you pass that and your name is on the BRN website that you have your RN license, you can sit for the interview. If you don't have your RN license or you don't have your test date prior to the panel interview, then we're going to pass on you, only because we want to fill those spots with people who can get up and start running essentially a month later when the cohort starts. If that happens and we have to pass on you, people worry that maybe that will not look good for future applications. No, it doesn't weigh. We understand that testing centers were closed for a period of time. We understand that the BRN in California is a bit delayed. So if you reapply, totally fine. But these are your dates just for your information. I always show this. People always ask about retention and what that looks like. We have a pretty solid retention rate. Our goal is always 100% within the first year. And so this is kind of where we are for our fiscal year. Fiscal year 2021 just kicked off. So we have a cohort of 55, and then we'll have 2 more cohorts following them. And then even going back to like our 4-year retention rate, looking pretty good. In terms of around 83% to 90%. So our new grads stay within the first year. If they leave, it could be due to a personal reason, which we have seen in the past. But our goal is to keep you. And if it's not on that inpatient area where you've been for a couple of years, you want to grow, we want to grow you within the organization. There's a lot of opportunities. So even if you move around, we still look at that as really good retention and growing you, because we know that you have a lot to bring and you're our future educators and leaders. And so we want to, and clinicians, and so we want to mold you and keep you within our Stanford community. Again, the goal of the residency program. So 1-year residency program, really the goal is to bridge you from that advanced beginner level to that competent clinician by that 1-year mark. We do so with a variety of ways, but it's really kind of that clinical skill that you're getting reinforced by some educational content, mentorship, leadership, commitment to evidence-based practice, and then really looking at your formalized individual plan as you move into that 2nd year, so we can support you through that. Our program follows Vizient. We are aligned with Vizient, and which Vizient did years ago when there was huge attrition within the nursing world, and nurses were not staying within the profession more than 1 year or leaving within their first year. They really looked at what the gap was. And so academic medical centers and schools of nursing got together and they said, how can we support these individuals and get them through their first year? Because it is a transition from student nurse to practicing clinician. And so these nurse residency programs were built. And essentially the goal on my end is not to reteach you what you've already learned in nursing school. Most of us don't want to go back to nursing school. We're like, done, moving forward. But our goal is to say, these are the concepts that were brought to you in nursing school. How do you apply them? So you know all about sepsis. How do you apply it in the clinical setting? You know all about cardiac. Let's talk about the cardiac diseases. How are you going to manage them? What interventions? How are you going to escalate care? What are you going to recommend to the team that you need to manage this patient? And really give you the tools to apply those concepts at the bedside. We focus on leadership, we focus on patient outcomes, and we focus on professional role. And the professional role is a lot about self-care, nurse resiliency, professional development, where am I going next? And then we talk about some ethical decision making with social determinants of health and implicit bias and end of life and palliative care and those kind of more global concepts. So really kind of looking at you as the whole individual, not just the clinical part. This is essentially our structure with the nurse residency program in the middle. We have monthly seminars where we bring all of our nurse residents together. The content is very, very diverse. Again, we have to follow a curriculum by Vizient, but also keep up with what are the strategic goals and visions of Stanford, and then what are kind of the current focus. So diversity and inclusion is something that is really big in our world, and so we're bringing that even more so into the program, as well as workplace violence. That is something Stanford is really passionate about and has done a lot of work on, so we are bringing that into our seminars. We do simulation. It's a little wonky right now because of COVID, so as these individuals on the call will say, they will be virtual next week, so we are going to see how that goes. But normally there's a skill aspect, there's working through cases, so you can really work as a team and demonstrate that knowledge that you have. You do an evidence-based project. It's aligned with the organization. So you can look at what is the best practice and are we as clinicians following that best practice? And if we are, great, we're reinforcing our work. And if there's a different way of doing something, then we need to look at that. And the nurse residents are kind of bringing that forward and they're passing that on to quality improvement, and quality improvement takes that and says, how can we make a change? We have a formal check-in structure. Stanford is a big place. 35,000 people work at Stanford. And so we know you can get lost in the shuffle, and we don't want that to happen. So as these nurse residents will attest, they have a dedicated nursing professional development specialist who follows them and will follow them throughout their first year, as well as myself, to really see how can we support you? What are your needs? Where do you want to go, and how can I help you get there? And then again, the clinical orientation piece. It's about 2 months of dedicated clinical orientation in the AAU environment and about 3 months in the ICU. So with the preceptor really working to get you prepared to safely transition into independent practice. That is all I have as far as content. I'm going to stop sharing my screen so we can see all of your faces, and we will open it up for any questions.
Don't be shy, ask away.
And Kevin, I don't know if you have any that you've been.
I've responded to a few privately already. There were some questions about LPCH, and I know we typically don't have any information about that, but do you have any insight, Kerry, in terms of how their interviews are set up? I believe it's similar, but I'm not sure.
Similar, 2 cohorts a year for LPCH. They hire about, I want to say around 25. Don't quote me on that number, but that is what they have done in the past year. Behavioral style interviewing, and I know they're doing virtual as well. They do have a nurse residency program coordinator, Christina Rivera. I believe her contact information is all on their website, so reach out if there's questions. But if the pediatric population is your passion, then absolutely. They have a great program. It's an accredited program. Smaller scale just because of their volume of staff. They don't hire as many just because it's not as big as the adult side.
Here's a question from an individual. This individual interviewed previously the last cohort, made it to the unit interview, but was not selected. However, this individual is very passionate about the unit specialty, and a lot of stories are based on that. She received more experience in the previous months. So do you think this individual would have a shot at that unit, or should that individual switch up their experiences or stories if selected for an interview?
I think if you have stories that really resonate with you and you're proud of, I would share those. If you've interviewed previously and you were selected to go to the unit level interview, what you said during the panel interview clearly resonated with the group, and they felt like, okay, I really liked what Mary said and I want to bring her back. I think there's also a part that managers look and say, how would this person fit within my team? And so they look at that a little bit. They look at team dynamics. It's really important in nursing that they feel like, and I'm going to quote this because it used to be on a nurse satisfaction survey, that you have a friend. So this is 12 hours of your life that you spend, right? In a pretty intense environment, caring for really vulnerable people. And so you need to be able to connect with other people as well. And so when they look at someone, they might say, I don't know if this person is actually the best fit for my team. And this other candidate, I feel like would have a more seamless transition. So that's another aspect. I will say that is why you want to allow yourself to shine, and you want that personality so people can see your personality. How will they work within my team? Are they flexible? Do they have a good sense of humor? Can they smile? Are they eager? Do they seem passionate? If you seem very quiet, rigid, it might be like, how am I going to get this person to kind of fly? I work, if I'm on case 7 where Vanessa is really fast paced, a lot of movement, you're dealing with trauma surgeons. It's no BS. You got to know your you got to know your stuff. You got to move. So if you're very, very quiet and kind of standoffish, that may not be the best unit. So there's that plays into it as well. In terms of, can you pick your unit? So you're going to interview for the specialty. So you will interview for surgical, medicine, critical care, or oncology. If I'm interviewing for surgery, that is ortho, trauma, cardiac, thoracic, transplant, abdominal, colorectal, minimally invasive, plastics, ENT, gyne-onc. Those are all of the specialties. The manager of the specialty will choose the person, rather than you saying, if your answers are like, during my trauma, I was in a trauma unit, and you speak to trauma, it might ping the trauma manager and say, well, they have a lot of experience. I think I want to bring them back for the interview. But the ENT manager may say, but I really like her. I think she'd be really good. I want to bring her for ENT. So know that the manager is going to be the one to bring you back for that specialty.
And Kerry, I believe we covered this already, but in terms of the length of the answer, is there a time frame target that you would recommend? Like 2 minutes, 1 minute, or 3 minutes, etc.?
We don't time you. That is an added layer of stress that you guys don't need, to be honest. And I've been in interviews where they time, and all you think about is my time instead of what you're saying. And so don't worry about the time. Facilitators will never cut you off. I think if you find yourself rambling, you need to catch yourself, reset, and then kind of save it towards the end. We've had people go, sorry, I'm rambling, let me clarify. And then they have this beautiful, clean answer, and that's totally fine. But don't get tripped up over the time frame.
And then, go ahead. There was a question about MEPINs. There was someone who graduated, or is graduating December 2022. Kerry, I don't remember what we've done in the past, but we typically wait until they actually graduate from the program before we hire them on, right?
Correct.
Oh, someone had a question. Go ahead, speak.
Sorry.
Hey.
Hi, I'm Ty. I have a question regarding trauma ICU. As many of you guys know, a lot of nursing schools don't provide, clinical rotations within critical care. And so the best that the closest I've gotten to was PCU at VMC. And I was wondering what kind of questions they ask at the interviews where, it would relate more towards the critical care units, where it makes you stand out versus the other units.
So Kate, when you interviewed for E2 at the unit level, well, first question, Kate, did you have an ICU rotation in school?
No, it was a step down unit.
Okay.
Yeah.
And then Kate, did you have an ICU rotation?
Did an MSN program. So I didn't have like a senior preceptorship or things like that. Like I did an evidence-based practice for my master's, essentially as my like last portion of my schooling. So I had even more limited experience basically. And I thought that was going to be like a big deterrent of like, man, I haven't spent as much time on the floor. And I was the one who made the comment of like, I spent a lot of time focusing on my care and compassion questions and different things like that. Again, they're not looking for you to have a full year of experience in the ICU. They know you're a new grad. They know that you aren't going to have that experience. And I think just showing in your personality and in your responses and in your ability to process situations that you can handle a high intensity environment and know that you're not going to know everything and you need to know your resources and things like that. Presenting that in your responses, I think, is more important than having specific experience in the ICU. I mean, I never stepped foot in an ICU before I was in this program. So just as a hopefully ray of sunshine of that is acceptable, and they know that that's going to be the case for most of their applicants, essentially.
Thanks.
Let's see here. Is it okay to use RN experience to answer behavioral questions? I started a temp job after I applied for this cohort, and my experience is currently not on the resume, so I just wanted to make sure.
Yeah, I think you can say I have experience from a current RN position. If the question is specific to a clinical rotation, I would err on the side of caution and answer for clinical rotation. If it's open, then you can answer for any sort of experience.
I would also like to add to that, though, since it's not on your resume, you can also bring it up in your About Me at the very beginning of your interview, because they'll ask you, tell us about yourself and all that stuff. Because in my About Me, I had mentioned certain jobs. I think I mentioned it in my first round, or maybe I did in my second round, I can't remember. But I mentioned like certain jobs that I've had and what qualities I gained from those that I could bring over into the nursing field. So I mentioned, like I worked at a restaurant. I mentioned how it's a fast paced, I mentioned that I was a resident advisor in college. I mentioned how there's other ways to incorporate your past jobs aside from answering the questions, if that makes sense. So I would say if it's something that you feel like should be known, bring it up in your About Me, but just like a quick snippet of what qualities you can bring over.
I would also like to add on where when I was speaking to my managers, actually, after I got hired, I was like, oh, what do you think that I could improve on, or what they wanted me to do? They did mention that they usually like to hear about your outside experiences in your second interview, because that's more personalized. And then that's where you could really dive into other aspects of you and that you could bring to the unit. When it's the initial interview, I think they would just like to, or I remember our email said specifically from clinical experiences, have your answers specifically from your nursing school or in-person clinicals versus bringing your work. So that's something you can also do. And if it's not on your resume, that's totally fine. Vanessa said you could just bring that in your About Me or intro part of your interview.
Kerry, should we assume that our panelists are very familiar with our initial application answers, or not so much?
So they have access to all of your applications. In terms if you want to reuse a story, that is totally acceptable.
Regarding the actual interview, will there be any evidence-based questions? And if there will be, could you give me an example?
No. No to the there will not be, not no to the I won't give you an example. No, the goal is not to trick you. The goal is all, tell me about a time when you, and it's not going to be tell me about a time when you incorporated evidence-based practice into your work. I mean, no.
And then I got this message a couple times already. No, I am not finished contacting everyone yet. We have a total of 200 who were selected for interviews. So if you have not heard from me yet, the last day is going to be noon on the 13th, which is next Wednesday. I saw in one of the information documents that managers should reach out to the applicant 72 hours after the panel interviews if offered a unit level interview. Does this still apply? Is it 72 business hours? And what if we interview on Thursday or Friday? Basically, they'll contact you either that very same day or the next business day.
I will say with that, you will be stressed waiting to hear back. So try, like, honestly, after your first round of interviews, go out, do like safely, like do something. For me, I went to the park, I read a book, I tried to get my mind off of it. Also, I had interviewed, my interview was like one of the very first interviews on that Monday. So I was super nervous. All my friends were like asking me too, like, how'd it go? Because for surgical units, it was Monday, Tuesday. And then that Tuesday, some of my friends had already been hearing back for the second round of interviews, and I hadn't yet. So, of course, that stressed me out. And so I didn't hear back from my manager for a second round of interviews until like that Wednesday, like in the afternoon. So don't compare when other people are hearing about second round of interviews, because every manager, of course, has their own like busy schedule and everything. Because my manager, when she called me, she was like, oh, like I had the day off and everything. I was like, oh, okay. So like definitely just try to relax. I know it's hard to say, it's hard to do, but just like try to focus on something else in the meantime.
Vanessa, Nijj, Kate, can you also give the audience today just your feedback on the unit-based interviews too? Because I've gotten a few private questions on that as well. Just how it's laid out, what types of questions, all that jazz.
I think each of us had the unit-based interviews are different for every unit. So again, don't compare yourself from what your friends tell you. But for me, my unit was still over Zoom. It was my manager and then also the assistant manager. So it's just them two, and then me. And from the beginning, even like on my phone call with the manager, when she gave me the second round interview, she told me, you can reuse your stories from the first interview. She told me that was okay, because the assistant manager wouldn't have heard my interview answers, so it was okay for me to repeat them if I wanted to. So that made me feel like reassured that like, oh my God, I don't have to like think about other answers. But during my second interview, they did ask me like the same type of questions. I want to say there was only like one question that was like different than what was asked in my original interview, but I still used my same responses. I think there was just like the one question that I gave a different response to. And then also, like with each question, they sort of asked me more about my response. Like, oh, so like you did this, like they sort of like asked me more about how I felt in that situation type of thing. And then also it was a good spot to like help clarify things like on my resume, because for me, I was fortunate to have completed 2 type of preceptorships in the ED and then also in a NICU. And so my questions actually went back and forth between my ED experience and NICU experience. For those wondering if it's okay to use like, other unit clinical experience and all that stuff. But yeah, so it was just more like clarification, I guess, on them getting to know me more and the type of person that I am. And it was a lot more relaxed too for me. I felt like it was more of a conversation, really. Like we were laughing and stuff, because I know there was a spot where I messed up and I like had a brain fart, couldn't think of the word I was trying to think of, and they helped me out with it, and then that sort of like eased the tension for the interview. But yeah, I don't know if Nijj and Kate want to talk about their experience too.
So my experience was a bit different. We had an in-person interview, but like safe distance, masks on, everything. And my experience was a bit different because when my manager, I think my interview was like one of the last interviews that were done for the surgical. And once my manager called me, we spoke for like an hour on the phone. So I felt like my second interview was on the phone while she was trying to schedule me for a time to come in. So when I actually went in for my unit-based interview, it was more of like, we're gonna tell you what our unit includes and how we do our new grad program. And it was more of like them giving me information just because of we were on a phone call for an hour. But some of the questions, I think the assistant manager was there and they asked me a couple of the questions, and it was more on, I realized the questions were almost the same, but for me it was more of how did I respond per se. Like they asked me on what were some things that I tried to work on as a student nurse. And I used examples of how I just was not confident talking to the team or reporting findings to like the MD. And they were like, okay, how did you respond to that? What did you work on? So it was situation, like they asked me 1 or 2 questions that were like, give us a situation of this. But then it was more of like, how do you respond to certain things? So that was, I think my interview was like a 30-minute interview. And the first 15 minutes was kind of getting the assistant manager to know me. And then the last was just information on what my unit or the unit that I was interviewing was practically about. My interview was specifically one-on-one. And they were like, oh, do you have any questions? And that's a great thing. Ask all the questions you have. They want to see what your concerns are. It's also a great time. I remember asking like, oh, how many people are you interviewing? And then how many are you hiring? I mean, it was an open forum type of situation. So I was like, oh, I'll ask whatever I need to. Or for new grads, like if they're struggling, what would you, for instance, I was concerned that after orientation, maybe what if I don't feel prepared? Do I have a chance to maybe extend my orientation time or certain things like that? And I took those 15 minutes or 15 to 20 minutes and I asked all the, random stressful questions that I had or anxieties that I had about, if I were to get hired, what are things that I'm looking for in a unit? I think my manager also mentioned that she liked how I showed what I'm trying to look for. And I tried to tell them how I learned best as well. So they could, it was a great moment to find out, okay, how would you learn and how would you best work in our unit if you do get hired? So I feel like mine was kind of different and very, it was much more relaxed. It was a conversation. We're talking about our days. It was a great experience, a lot less stressful than being in a panel and then having like 10 other people watching you at the same time. So yeah, that was my experience.
I wish that was my experience. So again, all unit interviews are completely different. So mine was literally the exact same format as the initial interview. So I sign on, there's 3 other people, other applicants, so 4 total. There's the manager, 2 assistant managers, the 2 unit educators, and a staff member. So again, you open up to this huge panel of people that you're interviewing with, and they literally ask the same, like not the same, but 4 core competencies, 4 behavioral questions, and then they had like a very brief period of time at the end for questions. So for me, it was basically like a repeat of that first interview. Still stressful, still all those things. I think I still sweated through my shirt like I did the first time. So it just varies. I chose kind of at the end of my unit interview, again, to use that time for questions to convey my personality, to ask and show like what I'm focused on and what I want to get out of it, much like Nijj did. So they're all different, and to try and have a set answer is impossible. I think all the managers do a great job though when they call you to schedule that of like, here's the format, here's how to prepare, here's what we want to get out of it. Like that was very clear to me before I entered it. So I knew what I was getting into again. So just kind of listen to what they're saying and try and use that as the best way to prepare, kind of like, okay, here's what I need to focus on for this specific interview.
Kerry, what would you recommend for those of us who had a majority of our clinical rotations virtually due to COVID, like especially when it comes to answering questions?
If you have in-person rotations that you can speak to those first. If you have an experience from a virtual clinical or a simulation that is considered a clinical that answers the question, you can speak to that as well. Some of the questions aren't just about taking care of patients. It's like feedback, or how did you communicate? How did you escalate? So that can also be virtual, right? So you can say this was during, the one thing you want to make sure you say is this was during my clinical rotation, which was virtual. And they know that it has happened and we understand that. Just make that so they don't think, is this a skills lab answer? Is this, make sure you let them know this was a clinical rotation that turned virtual. And you're not alone in that, and we understand it's the times. And so just be proud of that experience and share that.
All right, we have 12 minutes left. I'm going to leave it open to the floor. Do you guys have any other questions for Kate, Nijj, Vanessa, Kerry, Kevin? Hey, anything else?
So I saw a question that just came through. So for the February cohort, we received 520 applications. So we receive anywhere between, I think, 500 and 700 per cohort.
Oh, can I correct that? February was 555.
Oh, 555, sorry. Kevin, you'll post this recording. That was a question. Where can we find the recording?
Correct. I'll post it on Facebook. I'll post it on YouTube as soon as Kerry's recording converts. You're going to have to, I'll talk to you offline about that.
Okay.
And I went live on Facebook for about 5 minutes, and I recorded some of Nijj's responses and Vanessa's too. And then my battery died, so sorry.
200 people are interviewing for the February cohort. Just looking at the questions. Yes, we look at our internal candidates. If you apply as an internal candidate, we look at all of our internals and I actually am the one who reviews all the internal applicants. So if you are internal or currently working and haven't applied, please reach out to me. But we want to support our internal employees as they progress in their careers. So yes, we look at all of our internal candidates. On the unit-based interview, are situational questions possible? Yes. They may ask you a question related to the specialty and not a complicated question. But if you're interviewing for oncology, there may be a question about what is your passion for oncology? How do you feel in end-of-life situations, critical care? How do you feel in a fast-paced environment? So I think there are situational questions.
Kerry, can I respond to a question? Yep. To the person, Alex, I don't know if you want to emphasize more on your question about, is it okay to use the same rotation, for example, a med-surg rotation for the question, since I did go virtual due to COVID? Do you mean, is it okay to like use a med-surg answer for like 2 questions or something like that? Or I don't know if you want to speak up or type in.
Oh, yeah, I could clarify on that. Like, since I started virtual clinicals, pretty much it started halfway through my clinical rotations. I feel like I gotten more of my experience during my med-surg unit, and I feel like I could answer the questions through my, med-surg rotation. Could I just use that, or should I maybe use my fundamentals, or is it okay if I just go on with my med-surg?
I mean, I feel like, honestly, if you feel confident in your responses for your med-surg rotations, use those responses. Don't try to like think about what the managers are like wanting and all that stuff, like use the responses you feel most comfortable in. If they're all from your med-surg rotation, and they're all different examples, go for it. I know I had mentioned that I had used examples from like the ED and then also the NICU, but that was because I felt comfortable in that, but then also I wanted to show that I am able to, be flexible in different situations. But again, if you're comfortable with your responses and everything, and they are what made, I don't know how to describe. Either way, if you're good with your responses and all that stuff in your stories, like you feel confident in those, use those. Don't try to stray away from something that you think people will want to hear.
Okay, thank you.
And if I'm rejected, Kerry, how do you typically handle individuals who are seeking feedback about, how can they improve for the next time or the next cohort?
So you're always welcome to email me, and then I get like 500 emails. No, I'm kidding. It's okay. It's good. The only thing is I don't sit on all of your interviews, so I don't always have feedback. If you get invited to the unit level interview, you can ask the manager for feedback. The one thing is I'm happy if you want to shoot me an email or have a chat with me and we can just kind of talk through how you felt the interview went if I wasn't present during the interview. The thing I want you to remember is there's a lot of you and not a lot of us. And so sometimes the feedback is like, this is what this might be more helpful. Let me tell you what we're looking for. And maybe that will kind of help you in how the interview went. The one thing I would say is you are all incredibly qualified. You are all incredibly smart. You have done amazing work. It is incredibly difficult. I was a new grad 15 years ago and I read your resumes, reread all 555 of them. And I am literally like, how did I get a job at Stanford when this is the caliber of applicants? So it's amazing the work that you've done. Half of it is work. Half of it is what you bring as a person. Are you a team player? Are you flexible? Are you committed? Do you value the same things? Do you have personality? Are you compassionate? You gotta let that shine. When you looked at Nijj and Vanessa and Kate talk today, they showed you that. They're smiling, they're engaging, they're thinking, you can see them interacting. That is what they're looking for. If you're like, hi, my name is Kerry. I graduated from USF with my BSN in 2005. I did my preceptorship at San Francisco General. No. Hi, my name is Kerry Zoss. I'm a Bay Area native. I graduated from the University of San Francisco. My senior preceptor was at San Francisco General. It was a great experience. I worked with trauma patients. I'm getting to know this person. I'm seeing your personality. So talk. It's like a conversation. It's kind of like going on a blind date. If the person is dry and you can't get anything, you're going to be like, But if they're engaging with you, you're like, I can have a conversation with this person, right? So think of it that way, less as like I'm being drilled for questions. Rather, I'm going to tell people a little bit of what I've done. Take some of the pressure off of it, and then just try to be kind of true to who you are. Yes, you can use clinical examples from your master's rotations. Any of your rotations, again, know your audience. If you've done primarily virtual and therefore you're just going to speak about your med-surg, you can say that. My answers are going to be primarily about my med-surg rotation. Following my med-surg rotation, we went 100% virtual. The managers will be like, I get it, Alex, I get why you're talking about that. So just be honest, right? Just kind of share that. Any last questions?
Hi, everyone.
Hey, Kimberly.
Can everybody hear me okay? Yes. Hi, I'm Kimberly. Nice to meet everyone. Thank you so much for the information so far. I was wondering if we have a nursing portfolio, is there any way to share that with our interviewers, whether a panel or a unit?
So you can bring it to your unit level interview, but we give your entire application to all of the managers. So you don't need to submit anything additional. If you have updated something we talked about with your resume, you can speak to that during the panel. And then if you get the opportunity to interview at the unit level interview or unit level, bring an updated resume. That's totally appropriate.
Just like a tidbit on that. Sorry to interrupt. Is just that I had all of my done like virtual online, and so it was connected to my LinkedIn. So if the team had the time, it was all kind of connected through those things that they had links to and information for. And I think that that's also a way to just make sure whoever is viewing your application, if they have the time already, that it's there and ready and easily available.
All right, you guys, we're nearing our end and my nurse residents are gonna laugh because I have a post survey for all of you and I make them all do this as well. But your feedback is super important and we got feedback previously that it would be really helpful to have nurse residents on the panel. And so we listened, we brought them, 3 incredible nurses that I enjoy working with. So if you can grab your phone, scan the QR code, I think it's just a few questions, and then it just asks you at the end, is there anything that we didn't do that you would like us to present as we go forward? Kevin and I do this 6 times a year right now. We do it right before the application opens and right before the interviews. So we have an application webinar and an interview webinar. They're also all on YouTube. So if you go on YouTube and you put Stanford Health Care interview or Stanford Health Care application, you'll see the ones we've done in the past. you're welcome to view those as well. Just be mindful of the dates because if they're in the past, some of the information may have been updated or changed. But we appreciate you all being here. Remember, you're all incredibly talented and qualified individuals, and you're going to make a huge impact in our community, regardless if it's at Stanford. The need for nursing is huge, and you are the heroes of our world. If it wasn't evident before, it's definitely evident this past year. So stay true to that passion. If there's anything that we can do to support you, let us know. My email is Zoss, Z-O-S-S. So Zoss, Z-O-S-S, at stanfordhealthcare.org. So don't all email me at once. Over the next couple weeks. You can email Kevin too, right? Silvestre? No, I'm just kidding. So
Sure,
let
it's
us know
okay.
if you have questions, but take it all in stride. We thank you for joining us today. We wish you all the best. We'll see some of you over the next 2 weeks, and then hopefully see some of your names pop up again for the interview or the application that will open in March. So take care, everyone. Thank you so much.
Good luck, everyone.
Thank you.
Bye. Thank you.
Thank you so much, guys.
Bye. Thank you.